Shifa Hospital, most affordable and compassionate healthcare in city of Bijapur.
Welcome to The Explainer. Today, we're going to talk about something where every single second counts, a stroke. And there's one phrase you absolutely have to remember. Time is brain.
It's interesting. Most of us, if you ask, know the signs of a heart attack, right? Chest pain, pain down the arm. But what about a brain attack? It's just as deadly, but a lot of us, well, we wouldn't know what to look for. And that delay can be absolutely devastating. And let's be super clear about this. This isn't some kind of exaggeration. We're talking millions of brain cells dying every single minute that goes by. They're literally being starved of oxygen. That's why spotting it and acting fast is, well, it's everything.
Okay, so what exactly is a brain attack? Let's take a look inside the brain to see what's actually going on during the two main types of stroke. All right, at its core, you can think of a stroke as a serious plumbing problem, but in your brain. See, your brain is hungry and needs a constant, steady flow of blood to get oxygen. The second that supply gets cut off for any reason, those brain cells start dying. And it happens fast, within minutes. So this plumbing failure can happen in two main ways. Think of it like this. You've either got a blocked pipe or a burst pipe. The blocked pipe, that's called an ischemic stroke, is when a clot gets stuck in an artery. And that's the big one. It's about 80% of all strokes. The other kind, the burst pipe, is a hemorrhagic stroke. That's when a blood vessel actually ruptures, usually from high blood pressure, and starts bleeding into the brain. Totally different causes, but both lead to the same terrible outcome. But here's the amazing part. You don't have to be a doctor to be a hero in this situation. Nope. All you need is a superpower. And that superpower is a simple acronym. Be fast.
Okay, let's break this down. Be fast. B is for balance. Is the person suddenly dizzy or stumbling? E is for eyes. Are they complaining about blurry vision or, even worse, a sudden loss of vision? Then we get to the classics. F is for face. Ask them to smile. Does one side of their face just droop? A is for arms. Tell them to raise both arms up. Watch carefully. Does one of them start to drift back down? S is for speech. Ask them to say a simple sentence, like, the sky is blue. Is it slurred? Are they struggling to get the words out? And finally, the most important letter of all, T is for time. If you see even one of these signs, it's time to get to the hospital immediately.
So, you've spotted a sign, you've made the call. Now, an invisible clock has started, and you're in a race against it. This is what's known as the golden window. 4.5 hours. Remember that number. That's it. That's the golden window. It is the crucial period where doctors have their best shot at actually stopping and even reversing the damage. So why that specific number, 4.5 hours? Well, it all comes down to this incredible medicine, a special clot-busting injection. It does exactly what it sounds like. It dissolves the clot that's causing the blockage. But, and this is a huge but, it only works for that common blocked pipe type of stroke, and it has to be given within that window. And you can see here just how high the stakes are. Get to the hospital within that 4.5-hour window, and that clot-busting drug can literally dissolve the problem. The damage can be reversed. Seriously, a person could walk out of the hospital basically okay. But if you miss that window, it's a totally different story. The medicine is now too risky to give. And the damage that's been done, it's very likely permanent. Okay, so what can you do? Let's get into the hero's playbook. What to do, and just as importantly, what not to do. All right, you get to the hospital, the medical team is going to be moving fast, and you can help them. They're going to ask you one question right away. When did this start? Be as precise as you can. Your answer tells them if they're still in that golden window. Also, if you can, grab the person's current medicines and any medical files you can find. That stuff is absolute gold to the doctors. Okay, this part is super important. The do's and don'ts while you're waiting for help. Do lay the person down flat and turn their head to the side. Why? In case they get sick, this will help prevent them from choking. Now the don'ts. This is critical. Do not give them any food or water. Their swallowing reflex might be gone and it could go right into their lungs. Don't try to massage their arms or legs, and for goodness sake, do not give them any extra blood pressure medicine. Leave all of that to the professionals. So, knowing what to do in an emergency is life-saving, for sure. But what if you could stop this race against the clock before it even begins? This pretty much says it all. These are the main risk factors we need to watch out for. And look at that biggest slice of the pie, hypertension, high blood pressure. That is, without a doubt, the #1 cause. So getting that under control is the single best thing you can do, right along with managing diabetes, quitting smoking, and getting treatment for things like an irregular heartbeat or atrial fibrillation. That's how you protect your brain. So at the end of the day, if there's only one thing you remember from all of this, let it be this simple, powerful equation. Time lost equals brain lost. It's that direct. It's that brutal. And that's why Be Fast isn't just a helpful acronym. It's an order. It's a command that can save someone's life and everything that makes them who they are. So now you have the power. You know how to spot a brain attack, and you know what to do. You can literally save a brain. The only question left is, who are you going to share this with?